Top of the morning, guys. This is Mike and Brian with you. Happy Fantastic Friday to you, even though I have no idea what day of the week it is, wherever you may be. But you caught us on a great day because we did place second in soccer last night, but Brian's kind of feeling it. I'm sorry to hear that.
It's worth it.
It's totally worth it. So I'm a family and sports medicine physician and
Physiotherapist?
very good physiotherapist too.
Questionable. But depends who you ask.
Depends who you ask. Might be biased. Well, we thought today is a big day because we've got lots of questions, and we thought we'd start answering the Ask the Doc questions. So if you have any future questions for us, feel free to. How do they get a hold of us?
Text us.
Text us questions. Just text Brian. Text Brian questions. Maybe you could Facebook us questions. You can get a hold of Trist, our office
Call
manager.
in clinic, yeah. That'd be fine. We take it any way you want to give it.
So we're going to answer to our best ability lots of questions. So first one, theoretically, let's say I have a stud athlete, male soccer player, early 40s, a little bit washed up, and he pulls his hamstring again. How would you potentially treat that person with physiotherapy?
Theoretically speaking.
Theoretically. What are some key things that you look for?
I would say it depends on how acutely sore the injury is.
Let's say they can hardly sit.
Well, if per se that person was me, that it just happened to, then what's probably felt the best for me lately is to just get a nice, tight tensor wrap around it. There's different ways to do it.
It's a good compression.
Good compression is one thing I would suggest for really quite, not completely take your pain away, but at least you can walk, kind of relief. Some of the things I did last night, if it's acutely sore, if it's me,
yeah.
I wouldn't try to stretch it out too drastically because you're asking for more pain and more irritation. Like if Mike happened to palpate my hamstring today, it's really sore. So in the acute stage, I would just do things to settle it down. We already mentioned compression. Some people would suggest that ice would decrease pain, whether it's because it's numbing. You might hear different arguments as far as whether somebody might use heat or ice.
Yeah.
I typically say to patients, whatever seems to work the best for you, go with that. If people hate ice, and I suggest ice, I know they're probably not going to do it. So if they prefer heat, as I said, there's arguments for both, whichever one feels better in the moment.
And I think for a lot of the patients I've seen, probably more will prefer ice in that really acute, like when they can hardly walk. I think a lot find that for just pain control, and it's pretty common if you have some partial tearing with that hamstring. The most common areas usually are up high by kind of your butt bone, or just there's a tendon or myotendinous junction where that muscle tendon beats up, and there's usually a lot of inflammation. There's often maybe a hematoma that's formed in that area, and so maybe ice can help with that too.
Okay.
And I've even seen some people that are bad enough, they literally, it just really hurts to straighten that leg, and so we put them on crutches for a few days. But compression you found has been helpful.
Compression's been really helpful. I found as well that if I can just keep some subtle movements in there, that also helps, because if I sit for too long, or if a patient sits too long, and they go to get up, they're exquisitely tight and sore until it warms up a little bit. So I try to have a patient not to be, like you said, you want to use maybe a crutch or crutches, but at the same time,
you get sympathy.
Don't sit. Yeah, there you go. But I wouldn't sit all day doing nothing, because anytime you try to move, it just tends to be very sharp, very acute pain, as opposed to just some simple motions, not outright stretching, as I said, but just try to keep it.
So I guess in your perspective, if someone's like really acute and really sore, how soon do you want to see them? Like, can you do much when they're that painful, or do you want to give them some time before you treat them?
I like giving pain, so sooner is better.
But
I would say this to any patient: if a patient comes in with a hamstring or maybe an ankle sprain, would be a good example. I won't tell the patient that I'm going to necessarily work directly on the area that's acutely sore, but I will work on areas maybe around it, maybe above it, maybe below it, to make sure that if anything, the movement is as good as we can help it to be. And I find that oftentimes helps with the acute soreness as well.
Sounds awesome. Well, I think that's maybe a good review just of some simple stuff you can do if you have an acute hamstring injury. We'll talk maybe down the road about other stuff. Go
and
ahead.
that goes for any acute injury. The hamstring was just a great example. That could be a shoulder muscle strain or bicep, or the same things apply in my opinion. Some nice compression seems to have always been a good helpful hint to patients, as well as, like you said, the ice, maybe simple movements but not drastic.
Perfect. Well, maybe down the road we can go over, let's say if that hamstring injury is becoming more chronic, hopefully not. If it is, then we'll talk about what rehab would like down the road, or look like. What did they say? Rehab would look like down the road. So thanks again, guys. Have a great day. Thanks for joining us, and feel free to send us some questions. Take care.
Text.